We are starting in a short while, but just maybe to also urge that we can put our questions on our chat box so that at the end of this presentation, we'll be able to share some of the questions and answers as we proceed. Since we are ready to start, allow me to introduce the presenter so that he can take it away, and we are going to engage further. Mr. Davis Wekesa, welcome and continue.
Thank you very much, Mr. Arthur, for that welcoming note. I just want to take this opportunity to welcome our colleagues as we share in this discussion today. We have had various discussions surrounding process improvement, but today we came up with a very timely discussion, a discussion that is centered around us as one of the resources that is needed in our clinical lab settings. That is why this discussion today is basically on us. We as the service providers, how are we awake or how are we alive to the diagnostic realities that we are having as we proceed? So our topic of discussion today is staying awake through diagnostic realities. And this topic is, of course, well touching, and it touches on resource requirements. And when we are talking of resource requirements, you as a personnel, you as a lab staff, you are one of the resource aspects that that is needed for you to perform well or for the services to be discharged in a lab setting. So to go straight to our presentation, we are saying that you as a lab personnel, you as a service provider, you as a lab officer, you as a lab technologist, what do you understand by this topic of staying awake to diagnostic realities? Because I believe this illustration, pictorial illustration on our screen right now, it's speaking a lot. It speaks to me as a lab personnel. It speaks to you as a lab personnel. Most likely, if I were that illustration that is there, I would be asking myself, what position do I hold in the laboratory diagnostic space? What awaits me in future? Or what awaits me tomorrow? How am I prepared as a medical laboratory officer or a medical laboratory technologist to discharge these duties that await me tomorrow? Or how am I preparing myself, or how am I setting myself to be ready to discharge these duties that will be demanded of me tomorrow? How am I getting myself, how am I setting myself clearly so that I can attain the skills relevant for tomorrow or tomorrow's opportunity? So that is actually what this discussion is about. And of course, just on the outline, we will be having a very quite interesting and lengthy introduction, touching on various aspects, the changes in the laboratory diagnostics and how we are supposed to position ourselves in regard to that. Then we'll also be looking at what is the end game of staying awake. Why should you stay awake? Why should you stay alive as a medical laboratory personnel with regard to diagnostic realities as such? Then finally, we'll have a discussion of how do we achieve the end game? How then do we achieve the end game? And finally, as always, I always have a very nice parting shot for us as such. So staying awake to diagnostic realities. This actually speaks to the need for continuous alertness, adaptability, and professional awareness in the era where diagnostics is rapidly evolving. Colleagues, ladies and gentlemen, we must accept the fact that the lab environment that we have today is not the lab environment that we had 10, 20 years ago. The lab environment that we have today is not the lab environment that we will have 10, 20 years to come. So how are we as the custodians of the lab services, how are we preparing ourselves? How are we like restructuring our thinking? How are we positioning ourselves to make sure that when the lab evolves, we are also evolving as the custodian of the service providers? That is the basic underlying discussion that we are going to have today. And it goes without saying that in today's healthcare environment, the laboratory practitioners must remain fully conscious of the dynamic forces shaping diagnostic accuracy and patient outcomes. You as a lab officer, you as a lab technologist, you as a service provider in the lab environment, how have you positioned yourself? How cautious are you, or how aware are you to the dynamic changes that are taking place in the diagnostic world? And these changes that are taking place actually have a direct impact on result accuracy and patient outcome. So how have you positioned yourself? That is the biggest question that you should ask yourself today. Diagnostics at this current moment is no longer confined to the traditional methods that we used to have some time back. It is now an ecosystem defined by technological advancement, changing disease patterns, raising quality expectations, and the need for proactive, solution-oriented decision-making. That is the time we are living in as a laboratory environment at the moment. We are no longer so much interested in the traditional methods that were productive at that time. The diagnostic world has changed. The diagnostic models have changed. Of late, there are so many technological advancements. The disease patterns are also changing. We have issues of resistance. We have so much effort being put on quality demands or quality expectations. We are looking forward to people who are actually solution givers. How have you positioned yourself, you as an individual, in this changing environment? So staying awake means actually recognizing that diagnostic landscape is shifting in multiple dimensions. You must understand that the diagnostic environment, the diagnostic landscape is shifting in almost all directions. Sometime back, with the less specialty, we used to have so many of us who are general diagnosticians, okay? But right now, issues of specialization have gone in. And that's why even in private sector employment right now, we are not going for the general people. We are going for specialized aspects. If we want a hematology, we need a staff in a hematology department, we are going for specialties in hematology. They are no longer going for generalized personnel. With the technology advancements that we have right now in the sector, how are you positioning yourself for this? And therefore, we then dive into looking at then what are some of these dimensions that are changing? What are some of these dimensions that are shifting so that we see how we can position ourselves better for the coming days? Number one of such areas that has really changed and we need to know and understand and position ourselves better is that we have shifted from the traditional testing platforms to now more advanced technologies. That is the truth. Okay? That is a fact that we cannot run away from. So we are looking at it that the diagnostic field has moved beyond the conventional manual methods to high throughput molecular systems, advanced immunoassays, point of care technologies, and fully automated analyzers. If you are a technologist, you are a lab officer at this point of life, and you have not recognized or appreciated the changes, the technological changes that are taking place in our field, you will be left behind. Okay? So now that you understand that, yes, we have a tremendous shift from the traditional testing platforms to more advanced technologies, how have you, or how are you then positioning yourself to make sure that as we advance technologically, you also advance skill-wise? As we advance in terms of the testing platforms, you also advance your skills as a technologist or as a practitioner, a lab practitioner. So we are looking at it in the sense that technologists at this era must be prepared, one, to adapt to the changing environment. Number two, to learn, internalize, and practice with regard to the technological advancements that are taking place. And finally, you have to master these platforms to, one, maintain accuracy, efficacy, and the relevance. Colleagues, this is not rocket science. We must position ourselves. As we have tremendous revolution in the testing platforms, we should also, on the tail end, as the stakeholders, have a tremendous changes in our way of thinking, in our way of adaptability to these technologies, and finding a way in which through these technologies, you can actually measure the accuracy, the efficiency, and the relevance of these technologies as they come in place. And this knowledge must be sought out for, okay? Because when the technological advancements are evolving at a very rapid speed, more than you as a technologist, you are left behind. You are left behind. The second shift that we are seeing is that we have a very significant evolution of microbial behavior and emerging pathogens in our testing systems. So microbes are evolving, resistant patterns are changing, and new pathogens continue to emerge every now and then. So what does this information then tell us? Or how does it then, or what is required of us as the technologists? This requires laboratory professionals to stay vigilant, understand disease trends, and continuously update their knowledge to ensure appropriate testing, interpretation, and reporting. That goes without saying. We can take an example of when COVID hit us. Who are on the forefront? It's us. We were there. We were there. How are we prepared for this? This is something that we need to actually internalize, rethink our strategies as medical practitioners, so that as the evolution of microbial behavior happens, we also change and understand what is expected of us and how we are supposed to discharge our duties in preparedness for these changes as they take place. There is a very significant shift from compliance-based practice to competency-driven performance. And as a quality enthusiast, this is where I can actually speak with all the authority that I have. Because, colleagues, we are moving away from blindly following rules. We are moving away from blindly following rules, set rules. We want to understand what is behind these rules. What is the rationale behind these rules? That is the shift that we are talking about. Moving away from compliance-based practice for just following rules. You are just following that rule because you are told you should follow this rule. You do not question why that rule exists. You do not question the skills that are actually required for you to follow that rule or to discharge that rule that has been set. That is something we need to really focus on as such. So compliance-based practice, yes, it's good. We are not saying we shelve it. We must comply. But at the end of the day, competency has to drive compliance. Okay? Modern diagnostics demand more than just following rules. Okay? We are not saying stop following rules. Rules are there because they are supposed to be there. Okay? So, by and large, in as much as you are following rules, kindly ensure that there is competency behind those rules, that you have the right skill, the right attitude, professionalism to actually follow the rules as they're supposed to be. I always call this the tick box mindset. As you tick that box, kindly make sure you have the skill that actually warrants you to tick that box. Make sure you have the right attitude set to tick that box. Make sure you have the required professionalism to tick that box. It's never about just ticking boxes. And this is a discussion that we need to have. If you do not stay awake, technology will swallow you. Technology will swallow you. As technology evolves, you have to evolve. As we shift from compliance-based practice to competence-based, you must also shift. And how then do you get this competence? Competency is acquired by being awake, being realistic to changing dynamics, reading books, attending webinars of this nature, and internalizing SOPs and practicing as it's supposed to be. Okay? That is how you become competent. Competency should be a daily activity. Okay? So through this, it tells us that it requires a deeper level of competency, critical thinking, of competency. And when we are talking of competence, we are talking of your ability to critically think, understand what is behind that trick you are putting on. You must be in a position to solve problems. Okay? If there are deviations in temperature monitoring, you must have the capability of problem solving. You must have the skills, the right set of skills to solve that. You must be able to troubleshoot your systems when it's required. And you must have contextual understanding of why procedures matter. That is why I always insist that before we discuss how, let us actually discuss why they matter. Tell me why this is important, then follow it up with how am I going to do it? Okay? Competency now outweighs traditional checklist-based compliance. Okay? Let us go beyond compliance. Let us actually instill competency in ourselves so that we get to understand how that is done. We also have a shift in terms of there's an increased integration of automation. This is just an addition to what I had already pointed out, that yes, automation has transformed workflows, reducing human error and improving standardization. So staying awake in this perspective requires laboratory staff to understand automation principles, interpret system alerts, validate those instrument performance, and ensure seamless integration between manual and automated processes. Colleagues, I mentioned technologies have come, but you should control you. It should be you who is actually controlling the technology. It should be you who understands the principles behind those technologies. You should be able to troubleshoot any performance alerts as they come by. You should be able to validate these systems when they come in use. And you should also ensure that you have the capability to actually perform the quality assurance aspects with regard to the automated systems. Colleagues, do not let a system control you. You should have the right skills to control the system. The moment the system controls you, there is a problem. You should go back to the drawing board, rethink, re-strategize, and come back to control the system. And how do you control the system? You must have the right skills, the right knowledge to control that system. So we also look at a shift that is so significant. We are talking of artificial intelligence, AI integration into diagnostic systems. This goes without saying, most of our systems right now have an integrated AI platform in it. Colleagues, we must appreciate the fact that most of these AI integrated systems have actually been set to ensure standardization of our output. And when I talk of outputs, I'm talking of our results. We want to have standardized platforms. If it's with regard, for example, with the urinalysis, we want to have a standardized report, okay? So how are you prepared as a laboratory technologist or a laboratory officer or a laboratory practitioner to ensure that the AI platforms do not replace you? Colleagues, AI platforms are there to supplement you. But in the event that you find that an AI system is replacing you, it means your skills are outdated. Colleagues, you exist to validate the AI outputs, and you exist to maintain a human intelligence needed to detect anomalies or errors with those AI systems. So we say that AI-assisted interpretation, whether in hematology, pathology, genomics, and clinical chemistry, is shaping the future of diagnostics. That is a fact, and we can't run away from. So what is expected of us as the service providers? What is expected of us? Technologies must develop the capacity to work alongside AI tools. You must develop the capacity to validate the AI outputs. And you exist to maintain that human intelligence that is needed to detect anomalies and errors with that AI system. Colleagues, AI is not a gospel truth. It must be validated. And who validates AI? It's you. It's you as that professional actor. And how then do you validate something that is thinking or acting way beyond your capacity? You must be equipped. You must have the right skills. You must be fully updated with the system performance to put you abreast with what is going on. That is something that we must have a discussion about. AI, if you remain with your old ways of doing things, AI will replace you, okay? If you remain with your old ways of doing things, AI will definitely replace you. But if you stay updated with the AI platforms that are going on, you will understand that, yes, you as a professional, competent lab personnel, you are supposed to validate the AI systems. So let us expound our thinking. Let us prepare ourselves for what is coming, because as a profession, if you stay outdated, technologies will replace you. There is a very significant shift from traditional lab technician mindset to modern self-aware technologies. Let me just believe that in today's discussion, with these large numbers that we have today, let me believe my message is being received by the modern self-aware technologies today. Let me hope that we have shifted our mind from the traditional technician mindset. So the profession now demands solution-driven technologists who are self-aware, who are proactive, and confident in their role. So what is your role as a lab technologist? Do you understand what your role demands of you? Are you aware and are you proactive enough to set yourself out to understand what your roles are? My message today is to the modern self-aware technologist. And this modern self-aware technologist understands that modern laboratory practice of today and of tomorrow values individuals who understand, not just how to perform tests, but also why the tests matter and how results influence the broader clinical decisions. Colleagues, those of us who are in ISO 15189 compliance, we talk of the lab is the integral station that produces the results and interprets those results and gives guidance to the clinical team on how those results should be utilized. And even you are supposed, it gives you the powers to go further and give additional information on potential tests that can actually direct the clinician with regard to management of the patient. Colleagues, let us clear the mind shift from the traditional lab technician. And as we do so, we set ourselves, we position ourselves to the changes that are coming our way. Let us be people who discuss, test with the clinicians. Let us be people who give suggestions on additional testing areas that the clinical team can undertake to help that patient. Let us be people who actually discuss results with the clinical team. Let us be people who give input on the management of patients. Let us understand that for every result that you are giving out, it carries the life of a patient. So let us do everything possible, humanly possible, to make sure that, yes, our impact is felt. Number 7, we look at another shift that right now we have a deeper integration into clinical decision making. The technologies I'm talking about, the modern technologies, the modern self-aware technologies that I'm speaking to today has been deeply integrated into clinical decision making. And how is this so? You could be asking yourself, how is this so? Labs are no longer passive service points. Labs are no longer passive service points. That goes even without saying that the lab technologists are no longer passive service providers. The modern laboratory technologies that I'm speaking to the other end of this call is self-aware, is proactive, can discuss issues, can actually be engaged in clinical decision making. If you work in a hospital setting, for example, I want to give you a challenge today. You work in a hospital setting, and there is no any given point you have ever received a call from the clinical team on matters result interpretation, on matters potential additional testing areas, or on matters clinical discussion. This is a self-reflection point. Ask yourself this. Is it that it's the system that you are working in that has not embraced a holistic approach to patient management? Or is it that you as a lab practitioner, you have not put your services out there? Or three, is it that your services are in question? Because it could be any of those three aspects that I've mentioned. So diagnostic professionals increasingly participate in patient management discussions, antimicrobial stewardship teams, multidisciplinary care meetings, and quality improvement initiatives. Colleagues, here is where we need to come out clearly. I can pose a challenge for you here. There are these positions that are usually advertised in the name of quality improvement manager or hospital quality assurance officer or infection prevention officer. Why are our people not going for these positions? What stops you? What stops you as a modern self-aware combo for those positions? What are the you and I qualify for? Why are you not going for them? Why, for example, should be why should an IPC position be reserved for a nurse, for example? Why should a quality improvement manager be reserved for a nurse, for example? Colleagues, these positions are always there to be taken. These positions are not there to be given. And how do you take these positions? Make your services known. Make your quality enthusiasm known. Make your competence known. Nobody will come out to question why you have that position when they know the quality that you are bringing on the table. And how do we do that? Stop avoiding this subject, be the last one to speak. Pass out our interpretation to these matters. Because one thing I understand, and I can speak very frankly, is that the current crop of clinicians, those clinicians who have the interests of the patients at their heart, they will always have a discussion around patient results. They always have a discussion, a multidisciplinary discussion, because you want to have a holistic approach to issues at hand. I'm aware sometimes our clinicians, and when I talk of clinicians, most likely the clinical officers have an ego around that, but the modern day medical officers, you will always have a discussion with them. Even the physician, the consultants, you will always have an, in fact, majority of the consumers of the services that we are offering are actually the physicians, the consultant team. They're the ones who go all out to make sure that discussions are actually centered on patient improvement. So this requires better communication skills. You as a lab tech, you as a lab officer, my friend, improve your communication skills. Kindly come out with that cocoon of communicating with samples and start communicating with people. Have good communication skills. Have clinical awareness. Read books around issues. People will only listen to you once you have clinical relevance in discussions. And colleagues, let us enhance accountability. Discuss issues from point of information. Do not discuss issues from point of inferiority or something. And I can draw your attention to a given subject area that is actually, I don't know how people perceive us out there, but if this is the mindset that we are having and putting out there, it's raising a lot of questions. There's this discussion around false positives with TrinScreen and false positive with standard Q testing platforms. How do you as a laboratory practitioner actually approach this issue? You approach this issue from the point of science. TrinScreen, for example, I just want to give you an overview of this. TrinScreen. Why are there so many false positives in TrinScreen? Because it's doing its job. If you want to have that discussion with the caser, you can look for me on the sidelines. It's having so many false positives because it's actually doing the job the kit is supposed to do. It's a screening kit. Standard Q is pointing out those kits because that is exactly what it's supposed to do. So from the point of information as a laboratory technologist, you are supposed then to advise that every positive outcome that comes from a screening kit, it must be confirmed. Okay? That is the perspective. Screening kits are supposed to actually pick anything that mimics the condition at hand. And if that is what they are doing, then that is the right thing that they should do. That is why we have subsequent, more specific tests that actually now bring out the true, confirmed, definitive, true positive cases. So, colleagues, when we draw some of these discussions, even on our Facebook pages, even on our social media platforms, let us have a clear understanding of what message we are putting across there. Because somebody they might not raise it clearly to you, but it might bring out a message that is not so clear for you as a practitioner. Then there's a shift towards data integrity and digital documentation standards. We are saying that with the rise of electronic systems, LIS platforms and digital platforms reporting, the emphasis on data accuracy, traceability, and integrity has intensified. So the modern self-aware lab technologies that I'm speaking to today must uphold rigorous standards to maintain trust and regulatory compliance. There is, of course, a shift to expanded quality expectations from patients and clinicians. There are so high quality expectations from you as a service provider, by patients, and by clinicians. So the modern self-aware lab technologies that I'm speaking to today should stay awake. And that means you should be positioned well enough to respond to these pressures with professionalism, accuracy, and improved turnaround time. And finally, there is a very huge or enhanced growing need for ethical vigilance and professional conduct. Colleagues, just a quick one. Kindly forgive the noise on my background. I'm in a hospital setting. My office is just next to a pediatrician, so you can understand what actually happening in those rooms. Kindly bear with me. So we have a growing need for ethical vigilance and professional conduct. And that goes without saying that diagnostic realities extend beyond the bench, and it translates to communication. You must be self-aware of your communication skills. You must be self-aware of your social media behavior. You must be self-aware of confidentiality aspects, and you must always maintain an overall professional image, always. Let us not leave that to the gutters. So every action inside and outside the lab can impact credibility and trust. Colleagues, you could be a very good lab practitioner, but if your social media speaks out otherwise, if your communication skills speak otherwise, if you do not maintain patient confidentiality, and your professional image is questionable, you cannot be trusted. And overall, your credibility will be washed off. So let us look at our communication skills. Let us look at how do we use our social media spaces? How updated are we with regard to confidentiality matters? And in overall, our professional image, because it speaks a lot in silence. So now that we have looked at the shifts that are taking place, and we have looked at how better we can position ourselves, or what is expected of us as the lab professionals, what is the end game of all this? Why is this so important? Why should we stay awake? Why should we be alive to the realities that are taking place, to the evolution that is taking place in our diagnostic field? One is that we need a safer, a faster, and a more accurate patient care. Safer, faster, and more accurate patient care is expected of us as lab practitioners. So all these shifts with regard to automation, with regard to AI integration, with regard to competency-based practice, advanced testing platform actually exist to ensure that, number one, we have fewer diagnostic errors. Number two, we have a faster turnaround time. Number three, we have an earlier or improved disease detection. And number four, we have a better clinical decision-making process. In the long run, the ultimate beneficiary of all these aspects that we are putting in place is the patient. Sleep a patient, wake up a patient. Think the patient, walk a patient. Come up with all ways possible to align yourself to make sure that whatever you are doing is aligned to the patient's satisfaction. Of course, number two, we are looking at, in terms of the end game, we are looking at a modern laboratory workforce that is relevant and future ready. We want you to stay awake. We want you to be self-aware, because we are looking towards a modern laboratory workforce that is relevant and future ready. The profession is changing. The end game is to transition from traditional sample in, result out mentality to a highly skilled, analytical, technology-driven diagnostic workforce that can, number one, interpret complex data. We should look at ways in which we can venture into bioinformatics. We should also look at a workforce that can troubleshoot advanced systems. We must also look at a workforce that can collaborate in clinical care. We look at a workforce that can handle emerging pathogens. We look at a workforce that can integrate new tools like AI. And we look at a workforce that can uphold high quality performance in our diagnostic areas. In the long run, this ensures that technologies do not become obsolete in a rapidly evolving landscape. As we change, let us also, as the technologies change, let us also change with it. Technologies are there to be embraced, and it's our responsibility to actually make sure that as they change, we validate them. As they change, we ensure quality assurance practices. As they change, we validate the output that is coming from them. Number 3, we are looking towards a stronger diagnostic integrity and reduced risks. By staying alert to modern realities, labs reduce risks linked to, number 1, human error. Be self-aware. Be equipped with the right skills. Ensure compliance and competency. Human errors will be reduced. We're also reducing risks related to outdated practices in our clinical settings. We're also reducing risks related to poor data integrity. We're also reducing risks related to negligence. We're also reducing risks related to avoidable incidents, the normal occurrences that happen that can actually be avoided. We're also reducing risks linked to safety lapses in our diagnostic areas. So a vigilant, well-trained workforce protects the organization from compliance failures and reputational damage. And it's not just the organization alone. It's also you as an individual. You are also protected. Your professional image is maintained. So as we maintain organizational and professional images, let us stay vigilant and aware of the changes that are taking place in our systems. Of course, endgame number 4 is operational excellence and sustainable efficiency. And to this, we speak to the fact that the endgame is an efficient laboratory system built on, number 1, optimization of workflows. If you are aware of the changes that are taking place, your workflows will be optimized. We will have lean processes. We will have a very greatly reduced wastage in our operational areas. We will always be focused on automation-supported productivity. I said automation is not there to replace you. You are supposed to check automation. You are supposed to counter-check automation. You are supposed to validate automation and automation output. And how then do you position yourself? You must stay relevant to the current. Of course, there will be improved turnaround time and there will be consistent service delivery. So this holistically makes the lab competitive, dependable, and aligned with global best practice. Number 5, we are looking at the endgame as elevating laboratory professionals from technical doers to clinical partners. Ask yourself today, you who is present in this discussion, are you a clinical partner or are you a technical doer? We want technical doers who are actually clinical partners. We want technical doers who can discuss issues with the clinical teams. We want technical doers who are well equipped for positions that are actually related. We want technical doers who will stand out for the profession. So the long-term vision is for technologies to become contributors in clinical decision pathways. We want clinical practitioners to be advisors on diagnostic strategies. And this is very important because we have clinical pathologists in our settings today. Are you, as a laboratory practitioner, able to discuss issues hands-on with a clinical pathologist? Can you put your points out in a manner that suggests you have the clinical information and relevance that is needed as a practitioner? Because I'm aware we have our colleagues who are clinical pathologists, and some of them even admit that, yes, Wekesa, I do not have the required experience when it comes to kit validation. Kindly give me guidance on this. How is this done? How is this done? Okay? So it's a choice that you have to make. Have you positioned yourself with the relevant skills that somebody will come to you and tell you or ask for your guidance? And colleagues, don't think that this clinical team do not ask for help. They are always asking for help. Ask yourself, why is it that it's not you who is being asked for help? Just interrogate yourself for that. We are looking at clinical technologists who are partners in antimicrobial stewardship. We are looking at technologists who are collaborators in MDTS, that is medical diagnostic testing services. We are looking at laboratory technologists who are leaders in quality improvement. At the end of the day, this elevates the profession and expands its scope. We have people, we want people who are not just focused on lab testing. Go out and fight for these positions in quality improvement. Go out there and put yourself services to actually be in terms of consultant with stakeholders as such. Okay, let us have these discussions that can actually drive our profession ahead. So the end game number 6 is to build trust internally and externally. When a lab stays awake to evolving diagnostic realities, number 1, you become trusted. Your results or your services become trusted by clinicians. Clinicians trust your results. Patients trust the facility that you are working in because the services are credible. Regulators trust the processes that you have put across. The partners and stakeholders trust the collaborations. Colleagues, trust is the currency of healthcare. For those of us who are independent or how do I call them, standalone practitioners in lab, what brings you money? Trust brings you money. And how do you get that money? Trust brings you clients. How do you get those clients? Through referrals. How do you get referrals? Trust. Trust, credibility of the reports you are giving. So when you are aware, self-conscious of the changes that are taking place in our diagnostic field, you are confident on what is going on. Number 7, and finally, on the end game, we are looking at creating a culture of accountability, a culture of competence, and a culture of professionalism. The end game is a workforce that, number one, takes responsibility of what you are doing. If you are so sure of what you are doing, that what you are doing is credible, what you are doing is justifiable, what you are doing is reliable, then take responsibility. We are looking at a workforce that adapts quickly to the evolving changes. We are looking at a workforce that is able to communicate professionally. We are looking at a workforce that is able to follow procedures. We are looking at a workforce that is able to self-correct. We are looking at a workforce that actually prioritizes patient safety. And finally, we are looking at a workforce that respects institutional charter. Consequently, this actually creates a resilient, high-performing team. As we move towards concluding our discussion, how then do we achieve the end game? How then do we achieve the end game? We say that we should build and sustain workforce competency. Build and sustain workforce competence. And this is usually achieved through this cycle. Be willing to unlearn the bad practices. Be willing to learn new evolutions. Be willing to relearn whatever works for us, and let us always put in practice what works best. So let us unlearn the bad behavior. Let us learn, which refers to acquiring new knowledge and skills. Let us relearn, update and reinforce understanding. And relearning, this is part of relearning. Webinars, discussion, group discussions, engagements. It's part of relearning. Let us practice, apply and refine new skills. This is basically what I've just said. And learn, letting go of outdated practices, assumptions or habits. Learn, acquire new knowledge, acquire new skills. Focus on new technologies. Keep yourself updated and relevant. Relearn, revisiting and refining previously learned concepts with new insights. Practice, apply updated knowledge consistently and accurately. Number 2, strengthening quality, GCLP compliance, and data integrity. We say that achieving excellence in laboratory operations requires a deliberate and sustained focus on quality, strict adherence to good clinical laboratory practice. And I've always said, colleagues, you do not need to be ISO certified to be compliant to quality practices. Do it in the name of GCLP. That gives you guidance. Do not always use ISO as a justification for non-compliance. Do it in the name of GCLP. And unwavering commitment to data integrity. The 3 pillars form the foundation of trustworthy diagnostics and are essential for patient safety, regulatory compliance, and organizational credibility. How then do you strengthen quality? We draw our attention to this fact that quality is not an event. It is a continuous cycle driven by systems, behavior, and accountability. To strengthen quality, laboratories must, number 1, implement and consistently follow standard operating procedures. Number 2, Maintain robust internal and external quality assessment systems. Number 3, promote a culture of continuous improvement. Failing today does not mean you will fail tomorrow. Do not allow failures of today be failures of tomorrow. Where errors are addressed constructively and training needs are identified early. Ensure competency-based practice rather than routine task compliance. Integrate modern diagnostic technologies to reduce variability and boost accuracy. High-quality results directly support clinical decisions, reducing repeat testing and enhance patient trust. How do you ensure GCLP compliance? GCLP provides the framework for conducting laboratory operations that guarantee reliability, reproducibility, and ethical conduct of diagnostic testing. The key focus of GCLP include proper sample management, staff competence. You should be trained. Where retraining is needed, it should be done. And there should be documented proficiency in your skills. Facility organization with regard to cleanliness, safety, proper equipment placement, and workflow control. Documentation. And when it comes to documentation on data integrity, we always follow the ALCOA guidelines. And what are ALCOA guidelines? Documentation should be attributable, that is traceable. It should be legible, that is clear, readable, and permanent. It should be contemporaneous in the sense that it should be done in real time. It should be original and it should be accurate. Audit readiness. We must always have an ongoing adherence rather than reactive preparations when inspections arise. Consistent compliance ensures the laboratory remains aligned with global expectations, partner requirements, and regulatory standards. How do we uphold data integrity? Data integrity under GCLP standards ensures that laboratory data are accurate, complete, consistent, and traceable throughout their life cycle. With reference to the ALCOA principle that I've just mentioned in my previous slide. So documentation should be verified, should have verified and validated instruments, and let us have clear audit trails for all processes and results as such. Colleagues, that brings me to the end of our discussion today. But as always, I believe I'm speaking to the modern day self-aware laboratory technologist. And I have a message for you today. Whether you have already realized yourself or you're in the process of realizing yourself, if you do not prepare yourself for change, evolution in technologies or in diagnostic space will push you out. I have a message for you today. Staying awake to diagnostic realities is more than a theme for today. It is my call to you, and it's a call to transformation. In a rapidly evolving healthcare landscape, diagnostics can no longer be approached with a traditional mindset. Accuracy, vigilance, and professional self-awareness must define who we are and how we work. As technologies shift from manual platforms to automation, molecular systems, and AI, we must shift with them. As microbes evolve, we must evolve faster. As clinical expectations rise, our competence must rise higher. This means unlearning outdated habits, learning new skills, relearning as standards evolve, and practicing with consistency and integrity. It means moving from passive compliance to active competency, from routine processing to clinical impact, from technologies who simply perform tests to technologies who understand their role in patients' diagnostic journey. We strengthen quality by being intentional. We uphold GCLP by being consistent. We protect data integrity by being accountable. And we remain relevant by being adaptable. In the end, the future of diagnostics belongs to those who stay awake, not just physically, but professionally, intellectually, and ethically. Those who stay alert to change and committed to excellence. Colleagues, awake. Let us choose to stay competent. Let us choose to stay reliable, because every sample is a life. Every result is a decision, and every action we take shapes reality of patient care. Thank you, colleagues, ladies and gentlemen. And moderator, I bring it back to you.
Thank you so much, Mr. Davis. And let's stay awake to diagnostic realities, because accuracy drives better patient outcomes. We want to look at the questions that have been raised from the chat box from different participants, and we will start with a statement from Charles Moya, and he says, "Great presentation, Mr. Wekesa. Insightful. Kiprop Kosgei eye opener. Ross Mwende, I'm learning. Thank you, Mr. Wekesa. Willis Omondi, many thanks. Samson Dungu, the presentation is very informative. Mwalimu Kigunge, very insightful presentation. Samson Dungu, thank you so much for this presentation. Yusla Kipto Ngoch, thank you very much. And Patrick Mwirege, a very inspiring presentation. Lucy Mutu, a wonderful informative presentation, and so many statements from participants. Taj Habib, bravo, bravo, bravo. We have a lot of statements from our members, and so maybe we're looking at questions which might have been asked from the chat box. And Lilian Auma makes a statement, it goes, is this what we call AI technology, where you're given granules, you rub on your palm, and then it's read on a machine that gives you results? Mr. Wekesa, probably you can give your share of contribution on the same. I hope you've had that question from Lillian Ouma.
I
Kindly.
don't think that is related to the discussion. Probably there was a participant who had asked about urine, a certain urine test. I think she's she's following up on that.
Okay.
Yes.
There's another statement from Dina Matoke, and it goes, a good presentation and very insightful. Wondering if the practice is in place, but with the movement to clinical technologist can give it a trial. Maybe you can expand on the same. The issue of clinical technologists and how best we can adopt it. Probably you can give your take on that.
Thank you. Thank you very much, Mr. Hart, and whoever raised that perspective. When I began this presentation, I said some of these perspectives are not there. Some of these perspectives are not there to be given to you. Some of these perspectives are there because that you can do ABCD. Okay. The only problem that we have as clinical practitioners in terms of lab affairs is we have found a system of staying behind the show. Okay. We stay behind the curtain so much until we have found other people making decisions for us. Okay. So my call to you and myself is that when we get platforms to put ourselves out there, let us put ourselves out there. That's number one. Number two, make sure you have acquired the right skills and the relevance to exist in this diagnostic business. Because your skills, competency will speak for you even where words cannot speak for you. In my previous employment, for example, I was employed somewhere before I came to Sabalas at Kenya Limited. And I was an administrator of a hospital. So why me and not you? I've previously led IPC committees. I've previously led quality improvement committees, hospital, as a quality improvement manager of a hospital. Why did I get that? It's because I put my skills out there and people knew that Wekesa can do ABCD. That's why those positions were given to me. Okay. So kindly, nobody is coming to awaken you from where you are. Nobody is coming to fish you from behind that curtain that you are hiding yourself in professionally. It's you to come out here in hospital meetings, in hospital discussions, put yourself forth, let them know that yes, you have this skill that we are looking for. In discussions out here, be outgoing, bring out what you hold, and let it be from a discussion of information. Because if you do not put yourself out there, nobody will come to put yourself out there. It's just like in marketing, okay? If you hold your goods behind the room and anticipate that people will come for those services or goods, they won't. You have to put your goods out there. So let your skill, let your professionalism speak for you as such. In terms of clinical decision-making, engagement with clinicians, you do not need somebody to tell you that you need to engage with clinicians. Are you first approachable? Are you first approachable? Or are we still in the traditional mindset that those people only speak with samples? They are not humanly oriented. So once we bring out ourselves out of that cocoon, then we put ourselves here, those discussions will flow. Show why you should be consulted. Because nobody consults when you have not shown why you should be consulted. Kindly let us think in that direction. But colleagues, this is what is happening in our clinical settings. For those of us who are in ISO, we receive over 100 calls per day just because of consultations. Okay? So let it not be that the ISO conformed people are the ones doing this. In wherever you work, show your relevance. I said it's not all about ISO. You can conform to GCLP guidelines. If you conform to GCLP guidelines and put yourself out there, people will always consult you. But if you hide behind curtains, you do not speak to people, even you do not discuss patient results with patients, it becomes a problem. Thank you, Mr.
Thank you so much, Mr. Davis. Let's look at another question that is coming. And this is a question from one Madam. This is a question that is coming from Madam Elizabeth Wanjiro, and it goes, it's a statement per se. As we embrace a world of rapid diagnostic evolution, to stay relevant, our union and board should regulate quacks and poor wages. This is the basis of lab personnel being able to be included on the table of leadership. And there's another question from Jonathan Koima, and it's a statement as well, and it goes, great presentation. Can you recommend any institution, sites, or relevant courses we can take to keep up to date as lab technologists, including emerging applications of AI in lab technologies? Back to you. A question from Jonathan Koima. Back to you, Mr. Wekesa.
Thank you so much. That is a wonderful question. That shows that somebody has been attentive and wants to actually build on professional relevance. Number one, it starts with you as an individual. Because, of course, we have those self-paced training and we have outside trainings. For me, I always say, stay updated, read books, gather as much information as you can, then seek for external trainers to internalize the concepts that have been. We have so many external trainers as such. We have, just to give a few examples, not to appear to be marketing anyone, but we have trainers in the field of quality assurance QMS practices. We have the likes of Mr. Kahara with Rankol Consulting doing a very nice job. We have UCAS doing these trainings, doing a very nice job. We have Keton Consulting doing a very nice job. We have ourselves at LMSK through these webinars, these discussions, we are doing a very nice job. So it's just a matter of you sourcing for whatever works for you, okay? Sourcing for whatever works for you to enable you position yourself for this diagnostic growth. And colleagues, just with regard to the previous statement that was shared, how did it come to be that somebody else can just come and do the rapid kit testing? It started by one person giving a chance to a non-lab professional and saying, oh, somebody came and said, let me see how this is done. And you gladly showed them, this is how it's done. The next day you are not there and you called that person, hey, I'm not in the office. Kindly, can you do that thing the same way you did it yesterday? Okay. And now it came to be realized, oh, so it means the technical expertise is not needed. On-job training can be, and it's us who gave an opportunity for this profession to be enfranchised. So right now, with regard to rapid diagnostic testing kits, your responsibility now as a lab personnel with the skills and the competency is to actually ensure the quality assurance practices. Because this is a war that may not end today. So where do you come in? You make sure that, yes, as you fight this war to ensure that our profession comes back to us, we must also ensure that those who are testing and they are reporting to us actually are doing the right thing. Number two, the discussions that we engage ourselves in, be it on social media platforms, Let us discuss issues from an informed point of view. You see, there's an argument you can find a lab tech has put on Facebook. Na ukiangalia hivi, you say, if I'm a lab officer and I have issues with this statement, how about the policymakers who have now conflagged themselves in terms of medical officers or consultants? How will they think of this profession when they see a lab tech has put such a comment? Okay? So that is a discussion. Be aware of what be self-conscious of what you are posting. Okay? Speak from a point of information. Do not just go out there because you want. And unfortunately, let us not create a culture of fighting our own. Fighting programs that are there to actually empower you. So with that, I believe my brother and my sister on the other side have been fully answered. Thank you.
Yeah, thank you so much. Let's look at our final questions that we have. And we have a statement from one Taj Habib, and it goes, most lab professionals do not have a single book. Monica Chesbro is in the phone. No, that's funny, but maybe it's true. But then there's another statement from Victor Oguero, and it goes, we as medical professionals using Train Screen has come to a great challenge because most of the kids turn positive. I think it's the same issue of many false positive from Train Screen that probably you can say, you'll be able to say a word about it. On Train Screen is bring a lot of issues, but then you can make a statement. I think the other day another presenter also made some statement on the same, but you can as well make a statement for the same. Otherwise, as you make that statement towards Train Screen, you can also give us your parting shot because our time is up. Thank you, and take it away.
Thank you very much. And I believe the Train Screen and standard queue thing are something that we have had an in-depth discussion about. But for the purposes of my colleague who might not have attended our discussion before, let me put this point this way. For you to decide on what kit you want to implement in terms of testing protocols, you must first ask yourself, what is the intention of this kit? What is the purpose of this kit? Is it a screening kit, or is it a confirmatory kit? Okay. And when it comes to screening kits are so much focused on the sensitivity, okay? The ability to pick positive outcomes. They are so much focused on the sensitivity. So in fact, if the literature that I've gone through indicates that Train Screen is a highly sensitive kit, almost 100%, okay? So what is the consequence of having a very highly sensitive kit? Is actually it's in a position to pick anything and everything that mimics or looks like, whether it's HIV or anything that presents like HIV in nature, it can be picked as a positive outcome. So the mere fact that a Train Screen kit is giving very many positive outcomes, colleagues, it's just doing the job that it has been designed to do. So that means then, since it's a screening kit, the positive cases that you have then identified should then be subjected to definitive diagnostic kits. And that is how these other two kits come in. They're very specific. Their focus is on specificity and not sensitivity as such. Okay? That is why you find, yes, I've designed a program that we should not give a chance. We should not give a chance for any potential positive to be missed. So what does TrinScreen do? It's designed to pick anything positive related as such. Such positive cases are then subjected to definitive testing with more confirmatory testing aspects. But then the biggest question that we should also ask ourselves, the people who did verification of these kits before they were put in testing, they somehow withheld some information from the people who are testing. Because when you do a verification of a kit, you did not, I'm very sure, when verification process was being done for these kits post-implementation, it was not done on all the three samples. For example, we have an option of plasma, we have an option of serum, and we have an option of whole blood. So, for example, I always insist that the sample type that you have used during the verification process, that is the sample type that you should use during the testing process. You cannot verify your kit with serum and use whole blood during testing. If you verified your kit with whole blood, then kindly stick to whole blood when it comes to testing. Real patience. When you verified your kit with plasma, kindly stick to plasma when it comes to testing. And if you verified with serum, stick to serum when it comes to testing. That's number 2. Number 3, colleagues, are we sticking to the testing protocols as stated? Kindly let us be vigilant with this. If a kit tells you procedure A to Z, kindly follow the procedure as is, where is, without giving any alternatives. Kindly. If the kit says that read results at 10 minutes and not anymore after that, kindly stick to that. Have a timer. Time that after 10 minutes you are reading your results. Most of these problems that are arising because we are creating shortcuts of our own. We are not complying to standards that have been set. Okay? But if you have complied to all this, and in the long run, there's a false positive, as you put it, that is just the kit doing its work. It's a screening kit. That's why you need to do confirmation. Let us argue best from the point of science. Colleagues, that's said and done. The same thing applies to standard Q. Every positive syphilis outcome on standard Q, it's a screening kit. It must be confirmed. Okay? Let us, you say, the other day I saw a comment somewhere on Facebook and I was really not amused. A colleague saying that that there are so many false positive standard Q syphilis outcomes until he has decided to focus on those with a thick line. That is a medical laboratory officer putting such a statement out there on Facebook. How then do you advise that? Let us not demean our thinking. Let us not demean our profession to that level. Let us argue from point of perspective. Let us argue from science. If you are not aware, there's no crime in silence. It's not a must that you comment on everything. Read books, ask questions, ask those who know so that you get guided. Colleagues, as I close up this, it is a challenge to me and you. Skills in medical laboratory sciences are paying people, and they are paying people well. They are paying people well. Ask any quality assurance officer from an ISO lab, an ISO certified lab, how much do those ISO quality assurance officers earn? Ask any person holding a position of a quality improvement officer, manager. Ask them how much they earn. Ask anybody who is holding an IPC management position how much they earn. Ask anybody who is actually in ISO lab and is in a management position how much they take home. Colleagues, let us not I see my friend Joseph Kangede has just asked me how much. Tell us. Joseph, I know of quality assurance officers earning 300,000 per month. I know of quality assurance officers earning 200,000 per month. I know of quality assurance officer earning 150,000 per month. I know of managers earning 250, 300,000 per month. In these very healthcare systems that we are having, how did they get there? That is a question that I can leave for you. But kindly, let us focus on making ourselves better. Let us focus on putting ourselves out there. Let us focus on making ourselves available. Let us make ourselves available for discussions. Thank you very much, colleagues, ladies and gentlemen. For those with specific issues, we can have a discussion of the system because I'm very much available. We can always, through LMSK, they can share my contact or email so that we can have a discussion beyond these settings. Thank you very much. Let me believe my point or my clarion call today has been felt. And let me believe that I've spoken to a modern self-aware lab technologist. If you are not that person, kindly purpose to be that person. Thank you very much.
Thank you so much, Brother Davis Wakesa. As we end this webinar today, we urge all participants to click on the complaint form and share their complaints so that we can act on them. We also urge you to converge tomorrow same time so that we can have another presentation as we move forward in this holiday. Otherwise, wish you a good evening. My name is Athay Mari, and let's meet tomorrow. Thank you.